Hello and welcome to another episode of Hair Talks by Terra Medical. My name is Dr. Joshua Chong, and today we'll be talking about two buzzwords that dominated hair transplant terminology in the 2010s and in the 2020s. Now in the 2010s, all the hype was given to a robotic hair transplant procedure or robotic FUE. And now in the 2020s, we tend to hear more and more chatter about using long hair for transplant or long hair preview FUE transplant. So let's dive into it and find out what the differences are.
3, 2, 1.
Here we go!
So let's rewind back to 10 years ago where there was an introduction of the ARTAS robot into the hair restoration scene. This robot promised that it could do an FUE with just physician assistance. So that robot came with a huge arm that had a little punch and stereoscopic cameras that could aim exactly at where the hair follicle units were, and was said to have very high accuracy in terms of getting the hair follicles non-transected. This also reduced physician fatigue in the sense that the robot was performing the meticulous part of the procedure, if you will, and increased the graft yield because less of the grafts were transected. Now that particular robot has gone through a few different evolutions, and the latest version of the robot even has capabilities of making recipient sites into where the hairs are supposed to be transplanted into. And what I hear is that a future version of the robot is even able to transplant the hairs, taking over the role of certain hair restoration technicians. My personal experience with the ARTAS robot around about mid-2010s was that I've used this robot fair few number of times for various procedures. I would say that the robot really does give quite a lot of convenience in the sense that you just have to monitor the screen, make sure that the robot's parameters are set correctly, and the procedure tends to be quite smooth sailing. Of course, you have to select the correct patient to undergo a robotic hair transplant procedure. Quite a huge area has to be shaved in order for the robot to harvest enough grafts, because it has that margin of safety where it will never harvest too close to each other. And the robot seems to result in having larger FUE scars in the short term. They always heal very well at the end of the day anyway. And now we are in the 2020s and there is a new guy on the block. It is actually long hair transplants. This comes in a few different versions, either the no-shave long hair transplant, where the hairs in the donor area are kept long and harvested while they are long, trimmed before re-implantation into the recipient area. Alternatively, some practitioners use a long hair preview hair transplant, where they extract long hairs from the donor area and implant long hairs into the recipient area to give an idea of how it will look like once all the hair grows out in a year's time. FUE technology has advanced to the point where various machines can carry out these long hair procedures in clinic. You don't need to have very bulky machines with suction assistance, just need the right tools and definitely the correct patient choice in order for you to carry out a long hair procedure. In our practice, long hair FUE extraction is usually preferred to be done on our female patients, and for slightly smaller cases, less than 1,000 grafts for example. This is because long hair FUE tends to take a little bit longer time to do. The other drawback about long hair FUE is that you do not actually get to bandage a donor area, and too many grafts harvested also will equate to a larger area of open wounds, and the remaining hairs that attract dirt can actually result in some kind of wound infection. Not that we've encountered any of such complications before, but that's just a precaution that we take for all our patients. So what I really like about this long hair FUE technique is that we can use a very basic, simple punch. We use the Travellini system with a long hair punch. It allows us to visualize the donor area's density while harvesting, so that we do not encounter a situation where we over harvest the donor. it also allows us to look at the grafts after implanting into the recipient area so that we kind of know that the density is sufficient. Even though the grafts will shed and end up growing again some months in, we're kind of more assured about the density at the point of surgery. The other thing that patients really like is the reduced downtime. Now, ladies that have to shave an area of their donor to undergo a hair transplant tend to be a little bit apprehensive when you tell them about it, but when you give them the option of being able to do a long hair transplant, they're a little bit more receptive to the idea. So you're probably going to hear a lot more information about long hair transplants or no-shave transplant techniques in the near future because of the advancement of FUE technology and its popularity worldwide. What you really want to look out for is a practitioner who does these procedures regularly and can show you some results from his previous procedures, and also kind of ask this practitioner what are the differences in his results between doing a shaven method and a no-shave method. And this will give you a better idea as to which one you want to go for, understanding the pros and cons of both. So regardless whether you choose a robotic FUE procedure or a no-shave long hair FUE procedure, what you really want from the procedure are results. And these results are only going to start showing up 6-9 months later when the grafts have shed and started a new growth phase, and there's no two ways about it. You gotta have some patience to wait for the results to appear. So what I think we'll be hearing a lot more about in the 2020s, in the next decade, about hair restoration are more people venturing into long hair transplant procedures, new techniques, new punches, new equipment available to execute these procedures, and possibly even the widespread adoption of this being the standard of care. In the future, we'll be doing a separate video on the long hair no shave FUE transplant technique, our technique, as well as show you some footage from the procedure itself. But in the meantime, if you've got any questions regarding long hair transplant, feel free to leave your questions in the comment section below, and don't forget to click like and subscribe, and we'll see you next time. Bye.